of the Strategy Committee of Access Health Connecticut, of the Board of Access Health Connecticut. And with that, Marcin, do we make the announcements first or should we do a roll call first?
I believe you can make the announcements first.
Sure. As per our usual practice, we request that participants introduce themselves every time they speak. A roll call will be taken for every action item. And this meeting, as you've heard, is being recorded for minute-taking purposes, as well as posting the recording of the proceedings on the agency's website. This meeting is also live streamed on the Access Health Connecticut website. And thank you all. And Marcin, if you could please call the roll.
Yes, Mr. Chair, Steve Hernandez.
I'm present.
Thank you. Grant Ritter.
Here.
Thank you. Paul Philpott. Alexander Borkowski. Matthew Brockman. And Kathleen Holt.
I'm here. Thank you.
Thank you.
Thank you, Marcin. And could the members of the Access Health Connecticut senior leadership staff please introduce themselves?
Good afternoon, Gina Walsh, Director of Operations, Access Health CT.
Good afternoon, Susan Rich-By, Director of Legal and Governmental Affairs, Access Health CT.
Good afternoon, John Carbone, Director of Small Group Product Development and Broker Support.
Good afternoon, Tammy Hendricks, Director of Health Equity and Outreach, Access Health CT.
I believe, Mr. Chair, that concludes the introductions of the senior leadership team.
Thank you, and I appreciate that. And Marcin, is there any public comment?
No, we did not receive any public comments, Mr. Chair.
Well, thank you. I believe now it's we can do our first order of business, which is to accept the meeting minutes from our June 12th, 2025 Strategy Committee meeting. Is that right?
That's correct, Mr. Chair.
At this point, we would take a motion to accept the meeting minutes for June 12th, 2025. May I have a motion?
Yeah, motion to accept. This is Grant.
Thank you. And a second.
I'll second that motion.
Oh, thank you, Kathleen. Thank you. And having been moved and properly seconded, is there any discussion on the meeting minutes? Any changes? Hearing none. Marcin, if you could please take a roll call vote.
Steve Hernandez.
Yes.
Thank you. Grant Ritter.
Yes.
Paul Philpott. Alexander Borkowski. Matthew Brockman. And Kathleen Holt.
Yes.
Thank you.
Thank you so much. And now we move to the substance of our meeting. And I know that there's an update. We're going to start with an update on the Broker Academy. Is that right?
Correct. I am up.
Thank you.
Good afternoon, everyone. Tammy Hendricks, Director of Health Equity and Outreach. I have a very brief but great update for you all on the Broker Academy. We hit a milestone this year. We had 29 students pass the state exam, which is the highest number of students to pass since the launch of the program. And although this year's class was just a bit smaller, we had 50 students compared to nearly 80 students in our first class. We still maintained a high retention rate and pass rate. So I think with the higher pass rate, it's just a reflection on the yearly improvements we've been making on the program since we've started. Every year is something new, something different, and we're trying our best to give the students the best experience throughout the program. So graduation is scheduled for the end of October, just in time for open enrollment. And this year, more than ever, it's going to be really important that we work closely with not only the Broker Academy graduates, but also, our entire broker community. But the graduates are a huge asset here. They're from a lot of the communities that are going to be impacted by the changes. And so we have them and the other brokers as well, other certified brokers, at all of our in-person events, supporting us throughout open enrollment, which we have 23 enrollment events planned throughout the season. So the community really gets the support from our team with the enrollments and with the Broker Academy students and our certified brokers, giving them that advice on choosing a plan, which will be very important this year. So over the past year, 4 years, we've had over 100 brokers so far that has passed the Broker Academy program. And now they're all back serving their communities, helping mentor new students that are coming through the program. So things are coming full circle for us. But really short update for you all today, and I'll pause for any feedback or questions. Thank you.
Thank you so much. Are there any reflections or questions on the Broker Academy update?
I have a question. This is Kathy Holt. Can you
Okay.
speak to the brokers? How do I want to say this? I understand through the Broker Academy that they are focused on Access Health insurance, but can you speak to how they learn about other types of insurance coverage, such as Medicare and Medicare Advantage?
Yep. So they don't only focus on Access Health. They're fully licensed. They focus on any and all insurance plans. So we have the program is run by a state approved vendor, Kaplan. Kaplan provides the training for all of our brokers, so they learn about. That's where they get the basis of their training. After the training course, they then are paired with mentors. And so they get that hands-on experience in the field to go through the Medicare Advantage and all the other offerings that they do work with. So it's not just Access Health plans, and they're not just Access Health brokers.
Appreciate that. Thank you.
Yeah, no worries.
Great question. Thank you. Any other questions or observations? Hearing none. Tammy, this is so great. Thank you so much for this really positive update. Just knowing that not only do we have buy-in, but you're building an alumni network that keeps growing. I would imagine that there are continued supports or at least touchbacks with the network that you're creating. What a service, especially in uncertain times. So thank you, Tammy.
Thank you so much.
Thank you. Next, we have our 10 Clicks update, I believe.
Thank you. Good afternoon. I'm Katie Hearn. I'm the Associate Director of the Enterprise Project Management Office at Access Health Connecticut, and I will give you a brief update today on the 10 Clicks project on behalf of our IT Director and Project Lead, Marquise Davis. As you know, Access Health Connecticut's been planning the 10 Clicks project to modernize our integrated eligibility and enrollment system. We are in the final stages of preparing the RFP, and our internal review process is underway. Although we can't go into too much detail at this point in the RFP process, we are on track with our tasks and deliverables. A critical part of this effort has been our ongoing collaboration with DSS. This collaboration will be essential to ensure that we more efficiently serve all of the stakeholders who interact with our system. Once the vendor proposals are submitted, Access Health, in partnership with the DSS, will begin the evaluation process. From there, once a vendor is selected, we will move swiftly into the implementation phase, ensuring that the right structures and resources are in place to support a smooth start. And we'll continue to provide high-level updates at each phase to keep you informed while observing the necessary protocols of the RFP and evaluation processes. Thanks for your time today. I can take any questions if you have them.
Thank you. Any questions or observations on 10 Clicks? Thank you. This ease of access is so incredibly important. You know, I think one byproduct of automating in the way that we are is that people really do expect good, clean, accessible service and as few clicks and as few diversions as possible. And our continued commitment to streamlining access is super important, especially for people who are either new to technology or learning the technology. So thank you. Please proceed.
Good afternoon. I'm Gina Walsh. I'm the Director of Operations here at Access Health. I'll be giving you an update on our call center projects. On July 8th, the call center successfully implemented a speech-enabled interactive voice response system, IVR, which we're very excited about. This upgrade enhanced language accessibility and consumer interaction. Some of the key enhancements were expanded language support. So in addition to English and Spanish, which we currently had, the IVR now supports 4 additional languages, which are our next top languages that call into the call center: Portuguese, Haitian Creole, Arabic, and Ukrainian. This allows callers to communicate more naturally in their preferred language, and then when they get to a agent, the agent knows what language and can already have an interpreter ready to help assist on the call. So it also lessens the time of putting the caller on hold, and then they can get right to the root of the issue that the consumer is calling about, or to help them enroll. Also implemented was a text-to-link feature. So this feature enables consumers to receive a text message containing helpful links to our website that provide answers to common general questions, such as, you know, what do I need to actually enroll? What type of documents? Or, you know, what type of verification documents are needed? I got this letter and I don't quite understand. We could send them a link that has a very detailed list of all the documents that would be required. So on average, actually happily so surprised, about 400 texts are sent out daily to our consumers. We weren't quite sure how consumers were going to react to this, but we're very happy to see that consumers are definitely using it. Also enhanced call routing. So sometimes because someone enrolled through us, you know, for either carrier coverage or for the Husky program, they call again our call center, but it's something that's based on benefits. So we do have the ability now that if they are calling about benefits or a bill or something that doesn't have to deal with Access Health, they could actually be transferred automatically instead of having to jot down the number and hang up. So that option is utilized about 60 times a day. So very excited that folks are getting, you know, to where they need to be to begin with. So, but we continue. So this was just the first step, our first phase in our enhancing of the integrated voice response. Next, we're planning to implement an auto authentication functionality within the IVR, and that will be in October. And this enhancement will improve consumer experience by allowing customer service agents to address the caller's issue more quickly and efficiently, because they'll know who they are when they've come through, if they've authenticated. So it'd be for consumers that are already in our enrollment and eligibility system. So very excited about all these technology changes. And again, you know, streamlining the consumer so that they can get the information or enroll faster. Thank you for your time. Any questions for me?
Thank you so much. You know, I have an initial question just to get us started. Sure. This is really exciting, the additional languages and the language feature. You know, one theme I think that we've seen among leaders in the state recently is increasing language access for the diversity of speakers and communities in the state of Connecticut. And so I'm curious, and I'll be curious to continue to hear updates on your implementation, how language access is actually improving on wait times and access. What are the demographics of languages that we're hearing? And the reason I say this is because in some ways we could be one agency among several that I can think of that can model what a statewide strategy might look like on language access and opportunity.
Absolutely. We can get that information for you.
Thank you. And again, it's less about, you know, giving you stuff to do for me and more about the fact that we're tracking it. I think it'll be, Access Health is definitely modeling something really important. So it's really by way of, it's really congratulations on what you're doing and encourage you to continue to track, but also expand. So thank you.
Absolutely. Yeah. And what we do too, just so you know, is on a monthly basis, through the language line that the call center uses, we know what different languages are coming through the call center. So we're able to track and, see on a monthly basis and then look at yearly, what's the top. So those were the top 6, obviously English, Spanish, and then the other 4. So it's great to look at it to make sure that people are getting the help they need.
That's great. Thank you. Any other questions or observations? Thank you so much.
Good afternoon, everybody. John Carbone, Director of Small Group Product Development and Broker Support. Hope everybody's doing well. Quick Business Plus update for us. As many of you know, we've launched our platform effective 7/1. And our first initiative was to get out in front of the broker community. As of today's date, we have trained over 350 brokers with an additional 325 scheduled and staged for training over the next month and a half. Today, we were down in New Haven at the Hotel Marsala providing a training for about 40 brokers. And the training is more about sales strategy. It's about talking to them about how this product can help them out on a group side, how this product can help them on a small business side, and how this can help the consumer on an individual side, and talking to them about the concepts and the rules and some of the cost savings that these products can see. Over the past 2 months, we've quoted over 300 plus quotes for our brokers for a 1/1 place of business. Our strategic goal is to write over 5,000 individual members onto the exchange in 2026 and over 15,000 to 20,000 over the next 3 to 5 years. What we're really excited about on our platform is some of the feedback we're getting for our broker communities and the employers and the employees on how to improve the process, how to make it simpler and easy to enroll, and how to be able to have access. Initial feedback, the brokers and the employers are loving the different types of options that they can provide for their employees. And what I mean by that is in the small group market, they would see everywhere from 4 to 6 plans, but an employer would implement 1 plan. Now our members, our individual members, can look at both carriers on the Connecticut side and also on the Anthem side, and be able to look at all the 22 plans, including the catastrophic plan, and see what the best plan fits their needs versus having 1 plan just put in their laps. We're continuing to market out and focus super on our non-for-profits. That's where our main focus is. We know they're pinching their dollars. We're continuing to do marketing email blasts out to them and also scheduling meetings. Future to do a webinar with our non-for-profits. But again, we're just not making this a technology platform with webinars. We want to be in person and be out in front of them to show how this can save them money and help their employees pick the right plan for their needs and stay enrolled and be comfortable with the plan they choose. We do have some future stakes for the platform moving forward, and we're going to continue to improve and upgrade the platform for the future. And we have presented this to SOCIO and CMS and other state-based exchanges to allow them to see what we're doing here in Connecticut. And we're very proud to say that we are the only state-based exchange that has implemented a Business Plus ICHRA individual coverage health reimbursement product to their community. So we're really excited for what the future has to bring. We just have to stay focused and march forward and continue to educate with that also too. So at this time, I'll stop and see if you guys have any questions for me.
Thank you. Thank you, John. Are there any questions or observations on Business Plus?
Thank you.
That's great. Just a quick question, John, and you may have mentioned this and I may have missed it, but are you tracking this, the different types and sizes of businesses that are availing themselves of our Business Plus products, just in terms of being able to have a snapshot of where it is that you're making the most impact and where we're seeing the need?
Yes, sir. We're doing it. We're basically tracking 1 by SIC code, 2 by group size, 2 what marketplace they've come from. Was it a fully insured? Was it a partially self-funded product? Was it a self-funded product? We're documenting and keeping all those tracks, number of lives they're tracking, and and we're keeping all that information. And we're actually kind of mapping out and showing what percentages of savings we can potentially offer out. How many individuals are actually taking the ICHRA versus going to the APTC, or members that have maybe eligible for Medicaid and they weren't aware that they were eligible for Medicaid, and we were able to get them that savings in place.
That's really great. I mean, this is all about economies of scale and about enhanced access. And insofar as we're able to tell that story through the data, and just continue to make the case for this type of expanded opportunity and entrepreneurship on your part, I think that's really important. So thank you.
Really proud of what the team has kind of put out there. So thank you very much.
Absolutely. Thank you.
So it's back to me again. Just give you guys a little small group update. One of the things that we are talking and still working, we understand that this community has kind of taken the biggest hit. The rates are, as everybody's kind of seen today, are kind of in a position to where we're looking to give our small groups some creative options in doing that. What we're looking to do in the future is figure how to collaborate with our current brokers and employers in this market segment of 50 under and have that integrated into our Business Plus platform. There's more to come on this. We have developed an internal team that will start talking a little bit about strategy and concepts and integration into our Business Plus platform to create an additional tool for the brokers and employers to see how they can merge these two products together and be able to utilize these to basically, once again, put that tool in that toolbox for that employer and broker and be able to look at the different types of options versus a small group and an ICHRA product or a straight individual product, or seeing if there's other products available that individual members should be going to. So we want to keep that tradition of no wrong door and making sure we point individuals in the right direction. So more to come on this in the future once we kind of complete some initial strategies, and we'll be able to present at the next meeting.
Thank you, John.
You're welcome.
Any questions or observations for John? Great, thank you. And now we move on to, I guess the big elephant in the room here, Susan. And we've been looking forward to your update and just to fill us in on what's going on.
Thank you. Thank you. So we've got all the different federal changes here that are starting this year and coming in for next year for our consumers. If you could go to the next slide, please. Thank you. So there are 3 different items that are resulting in these changes. One is HR 1, the One Big Beautiful Bill Act that was signed into law on July 4th. Another one is the final rule that was finalized by the Department of Health and Human Services on June 25th. And also there is the likely expiration of the enhanced subsidies at the end of this year. We do know there are actually a lot of conversations going on in Congress. I'm sure everybody's reading the news just like I am and hearing different things right now. But, as of right now, they have not been extended. So if you go to the next slide, please, Marcin. Thank you. So in the One Big Beautiful Bill for 2026, and right now I'm going to focus on the 2026 changes. 2026, the legislation eliminates eligibility for financial help for individuals who are lawfully present but ineligible for Medicaid because of their immigration status. And those consumers have income below 100% of the federal poverty level. Normally that is the floor for APTCs, but because they're not eligible for Medicaid and they are lawfully present, they, up until this point, have been eligible for subsidies. Right now, we have about 5,300 individuals who fall into this category, so they will lose eligibility. They'll be able to enroll in a plan if they choose to, but they will not be able to have premium tax credits or CSRs if they're eligible for the cost sharing reductions. Also, in the final rule, an immediate impact in 2025 is eliminating the eligibility for DACA recipients, and that is actually, those terminations are going to start not start. They are going to happen in our system on September 30th at the end of this month. We are sending out communication now to those impacted consumers. I think it's about 140 people. It's not, we didn't have a big number of DACA recipients who enrolled versus some other states. And then they'll also get the system notices that come out. Now, some of these other items from the final rule, some of them are going into effect now or in 2026, and then some of them are actually subject to a stay. If you have read in the news, and I believe we sent a memo out to the board on this, there was a ruling in a case a few weeks ago in late August, City of Columbus versus RFK Jr., that has put a stay in place on some of these items. So one of these is allowing carriers to require consumers to satisfy past due premium debt before they take the effectuation payment. That one is actually subject to the stay, so that one is not going into effect right now. There's also an elimination of the special enrollment period for consumers with income below 150% of the federal poverty level. That one has gone into effect and is not subject to the stay. But fortunately, in Connecticut, nearly all consumers with income at that level would go into the Covered Connecticut program, which is not impacted, and that has rolling admission. They also have several changes to the verification on income in the final rule, and some of those are subject to the stay, so those will not go into effect yet. But one that is going into effect is shortening the period of time a consumer would have to verify their income from what has been 150 days over the last, I think it's 2 years, back to the 90 days that it always was and is for all of the other verification criteria. And then finally, probably the one that has the biggest impact across the board to the highest number of consumers is the likely expiration of the enhanced premium tax credits. We are trying to make sure that we message to everyone that not all financial help is going away. It is the enhancement of the tax credits that went into effect in 2021 under the American Rescue Plan Act that is slated to expire at the end of this year, but the original ACA subsidies will still be in place. So this does two things. It puts the cliff back at 400%. So those above 400% will no longer be eligible for financial help again, like they were not previously. And this is about 28,000 consumers. And then it also makes the subsidies smaller for everybody across the board who's eligible below 400. And so because of that, it will increase the state of Connecticut's cost to fund the premium portion of the subsidy for the Covered Connecticut program. If you go to the next slide, please. So we have looked at all of these different federal impacts and tried to look at our enrollment and our population and our previous enrollment. And we have estimated, and this is just an estimate, that of our current population, which is about 155,000 people, potentially 30 to 35% of those folks could be uninsured by 2034, not by next year. This is all the estimates that you read and the estimates that Kaiser and other folks have been doing. Look at it over a 9-year period up to 2034. And so this is why one of the messages that Tammy noted when she was talking about the brokers and Broker Academy is the importance for 2026 for consumers to use that help by a broker to help them pick a plan. We still have, we have a whole array of plan options available. So it might be very expensive for someone to stay in their current plan, but there might be another option that may be more affordable for them. So we want to make sure that people don't think, all help is lost either financially or with a broker. If you go to the next slide, please. So as I mentioned, one of the biggest impacts across the board is the expiration of the enhanced subsidies. So we have about 90% of our current enrollment that are receiving APTCs. This is about 141 or 142,000 consumers, and it is 50,000 people. We're now actually just over 50,000 people in the Covered Connecticut program. For the actual enrollees in Covered Connecticut, unless the state were to change something, it doesn't have an impact on the consumers. It increases the state's cost, and the state does have its 1115 waiver in place with the Fed. So that would go into that portion of the funding. And as I mentioned, unfortunately, the consumers over 400% of the federal poverty level, which is about 28,000 folks, would lose their eligibility for financial help. If you go to the next slide, please. So as I mentioned this previously, there are customers who are lawfully present but not eligible for Medicaid because of their immigration status with income below 100%. That is about 5,300 consumers who fall into that category. You go to the next slide, please. Another impact that's going in from the final rule is the premium adjustment percentage. This gets a little, technical and wonky, if you will, but if you want to look at a way that it's directly going to impact consumers and rising costs, you can look at that it allows higher maximum out-of-pocket amounts than were in the original rule when the rule was finalized, when the carriers filed their plans. So this represents a 15% increase compared to 2025 limits for maximum out-of-pockets. I do want to point out that all of our standard plans stayed with the original limits. We didn't do anything in anticipation of higher limits. Our goal is always to keep those maximum out-of-pockets as low as we can. So if you turn to the next slide. So another important aspect that is going away starting for tax year 2026 that we're going into is they are removing very important consumer protection for lower income consumers. So since the ACA went into enactment up until this point, there have been repayment caps with the IRS for people that receive excess premium tax credits. Their income changed and they wound up getting more than they were eligible for, and they have to pay it back to the IRS. For consumers with income below 400% of the federal poverty level, there were 3 different repayment caps below that to protect them from having to pay potentially all of the tax credit back if they weren't eligible at all, or a big tax bill in that manner. But those caps are going away. So one of the important things that we're going to be messaging to consumers starting in 2026 is that it's more important than ever to really make sure that you accurately estimate your annual income. And if you do have a change to your income during the year, that you come back in and update your application as soon as you know that there is a change, to really, try to prevent receiving excess premium tax credits. Next slide, please. Finally, what are we going to do about this? There's a lot we're going to do. So Tammy and her team will be very vital and important in this area. They use a community-first, data-driven approach. They're always looking at, where is the help needed and how can they help in the communities that need the most help. They have added 4 new mobile enrollment specialists to the team, which will really help increase their capacity. We are going to be holding enrollment fairs as we do every year all over the state, and we will have an increased navigator presence, which is activating those trusted resources within the community. In the marketing team, they are working very hard in this area as well, working on clear messaging so people can understand what's happening. And Caroline and her team actually did some focus groups over the summer. And when you start talking about their federal changes coming, it seems like people don't really want to hear the actual details. They just want to know, what is my premium going to be? What is my financial help going to be? What can I do? So we have messaging going out starting very soon, using mail, email, and text messaging to people to help them. We will have a mass media campaign in market, and we will message, the most important message, as I've been saying, is to shop for a plan and use a broker. Consider all your options, because we have many plan options, and really to use those vital broker resources to help you pick a plan. That help is free, and all help is free. On the operations side and the technical side, Gina and her team have increased call center staffing, and then Gina did a great presentation on the enhanced IVR system, which hopefully will really help us get out information to consumers. And the new feature as well for the call center reps to text links for helpful URLs. And also we have to make updates to our system. And also to point out that we put up a landing page on all these federal changes a few weeks back. And I know DSS likewise has one on the Medicaid side. So those are some good resources as well. You go to I think that's my last slide, Marcin, right?
That is correct.
I believe so. Okay. So I will pause and take a breath for any and all questions. Thank you.
Thank you, Susan. Are there any questions or observations on not only the result of the I hate calling it what it's called. So this previous legislation or this legislation and any of the impacts that are going to happen to our communities?
I use HR1, so I don't have to go into the other name.
Yeah.
No,
Go ahead, please.
No, not a question. But I do just want to say, Access Health combined with DSS had one of the best rates of keeping folks following the unwinding in Medicaid or getting them onto plans, the appropriate plans. And while this is, not the world's best reason to be, we love that and we don't love this, but we know how to do it. And I think this is a statement that we're going to help people get them to the products that they need to maintain care. And I trust the team will be able to get that done. So.
Oh, thank you for that. And we had, in addition to the unwind, which as Matt mentioned, was a really big effort across both agencies and all of you and a lot of other agencies in the state and the legislature. Several years ago, we also had a change that had been made about the standard silver plans that wound up resulting in some decrease in the subsidy amounts. And we approached it in a very similar way to really get the message out to people that this was the year, just like 2026, to shop, compare, and enroll, and to really use those trusted resources to make sure that you're looking at all your options and picking the best plan for you. We really have a wide range of plans. We work very hard when we design the standard plan designs to make a lot of first dollar coverage, a lot of benefits available before deductible. We even have that in bronze plans. So we, really just want to just keep at it, I guess, is our best approach.
Thank you, Susan.
Thank you.
And Matt, I think you're spot on. There's a comprehensiveness here. You've got a good balance of equity, you're communicating clearly, you're ready operationally, and it is encouraging that this is not only a strong response here, but it's the way we do business at Access Health Connecticut, and the way we do business in Connecticut, we do better by our people. So I really appreciate your role in that and this really important update. So thanks.
Thank you very much. Thanks, everybody.
Is there any other business before us today? I think that's it, Marcin. I think we're at the end of our agenda. So without anything further, I would ask if we could entertain thanking everyone for your thoughtful presentations and for your advice. We look forward to continue to support you in any way that we can, certainly. And so please feel free to deploy us in any way that you can, but also continue the good work that you're doing. Without anything further, I would entertain a motion to adjourn.
I'll make that motion, Kathy Holt.
Yeah, Grant.
Thank you, Kathy. Do we have a second? Thank you so much. Could we have a roll call, Marcin?
Yes, Mr. Chair. Steven Hernandez.
Yes.
Grant Ritter.
Yes.
Paul Philpott, Alexander Borkowski, Matthew Brockman,
Yes.
and Kathleen Holt.
Yes.
Thank you.
Thank you, everybody. Have a great afternoon.
Thanks.
Thank
You
you.
as well.
Bye-bye.